Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Volatile agents. Halothane. Halothane. Physical properties of halothane. Halothane is a non-irritant and it has smooth induction. Halothane causes decomposition occurs by light and it is stored in amber colored bottles. The preservatives used in halothane are thymol preservatives are used in halothane. Maximum fat gas coefficient of halothane is there is maximum fat gas coefficient of halothane, so the halothane will easily accumulate in obese patients. Halothane can corrode plastic and metals. Anesthetic property of halothane. The minimum alveolar concentration of halothane is 0.74% and it is most potent. Blood gas coefficient of halothane is 2.4. It has slow induction and recovery. Metabolism of halothane is 20% and the major metabolite of halothane is trifluoroacetic acid. Halothane also produces bromides, chlorides and fluoride ions. Systemic side effects of halothane. Halothane on cardiovascular system, it decreases the cardiac output maximally. It causes hypotension. Halothane also sensitizes the heart to the adrenaline. So as a result, it sensitizes the heart to adrenaline. Maximum adrenaline action is 1.5 micrograms per kg. Thus, because it sensitizes the heart to adrenaline, so halothane is contraindicated in pheochromocytoma. In respiratory system, halothane is less preferred than sevoflurane for asthmatics. In the liver, halothane causes halothane hepatitis. This halothane hepatitis is seen in 1 in 30 to 35,000 patients. Mortality of halothane hepatitis is around 70%. Halothane hepatitis is immunological. That is, um, it is immunological. That is, whenever there is halothane, it produces antigenic. This halothane is antigenic and it forms antigen antibody reaction, and these antigen antibodies will destroy the liver, resulting in halothane hepatitis. So, you will have to avoid frequent exposure of halothane, that is more than 3 month interval. Like if you have given halothane today, you should give halothane only after 3 months. There should be at least 3 months interval before using halothane frequently. Halothane is avoided in autoimmune diseases. Halothane, because of the halothane hepatitis, in halothane hepatitis, in a known case of halothane hepatitis, the inhalational agent of choice is sevoflurane, and this sevoflurane does not produce the TFS, that is trifluoroacetic acid.
summary. Halothane. Halothane is a non-irritant and thus it results in smooth induction. It gets decomposed by the light, so it is stored in an amber colored bottles. The preservative used for halothane is thymol. It can corrode the plastics and the metals. It has maximum fat gas coefficient, so it gets accumulated in obese patients. Anesthetic properties. Minimum alveolar concentration is 0.74%, so it is the most potent anesthetic, and the blood gas solubility coefficient is 2.4, so it has slowest induction and slowest recovery. Metabolism is around 20% and the major metabolite is trifluoroacetic acid. It can also form bromides, chlorides and fluorides. Then systemic side effects include on cardiovascular system, it decreases the cardiac output maximally and it also decreases the blood pressure. It sensitizes the heart to adrenaline, thus it is contraindicated in pheochromocytoma. It is less preferred in respiratory system. It is less preferred in asthmatics. less preferred than sevoflurane in asthmatics. Then in the liver, it can cause halothane hepatitis. Halothane hepatitis is seen in 1 in 30 to 35%, and the mortality rate is around 70%. Now, halothane will first produce trifluoroacetic acids, which are antigenic, and this antigen combines with the antibody, resulting in antigen-antibody reaction, and thus destroys the liver. So this is halothane hepatitis. So here we should avoid frequent exposure to halothane. There should be at least 3 months of interval should be there for exposure of halothane again, and it should be avoided in autoimmune conditions. If a patient has known case of halothane hepatitis, then the inhalation anesthetic of choice is sevoflurane.
Thank you, and thank you for watching.